Welcome, everyone. We're just going to give people a couple minutes to come in right before we start. Welcome to our first of 7 summer workshops that we will be presenting on Thursdays at noon. Since the declaration of COVID-19 as a pandemic, occupational health and safety has become a household issue. During this summer series, we hope to give you more background on information on occupational health and safety so that you have more information to make you and your clients be safe in the workplace. Just a note that this webinar is being recorded. You can get captions with this webinar at the bottom of the screen. You will see a CC button. Please put all questions in the Q&A function. And yes, all attendees are muted. You do not have to select anything. The moderator will make sure all questions, which is me, answered during the presentation or at the Q&A session at the end. If we do not get to your question, you will get an email from us. If you have any comments to make, use the chat function. At the end, there will be a survey that is required for people who want MCLE credit. But we invite everybody to give us feedback on how this presentation went, how the slides were, the closed captioning, and any other feedback you'd like to provide. Next slide, please.
Hold on. Working on it, sorry. There we go.
So we will have 6 more sessions. Please join us at each session. We will be providing more advanced information as each session progresses. Next slide, please. I'd like to introduce you to our panelists. They will give a little background about themselves. We have Nicole Marquez Baker. She is the Director of Policy and Legal Services. Maggie Robbins is our Occupational and Environmental Health Specialist. I am a staff attorney and the moderator of today's program. Nicole or Maggie. Nicole, go ahead and introduce yourself.
Sure. Hi, everyone. My name is Nicole Marquez with WorkSafe, and really, very pleased to be able to present on these very important issues that are definitely impacting folks right now.
And I'm Maggie Robbins, and I just give you a little bit of background on me, as I've got a couple of decades of experience working in occupational safety and health, primarily for unions, nonprofit organizations, labor educators program, and as a writer. So I've helped workers over the years negotiate for better protections on the job, to advocate for themselves, to know their rights and how to use them. I look forward to working with you today.
We wanted to share with you today WorkSafe's mission statement, preventing worker illness, injury, and death by bringing justice to the workplace. We engage in policy advocacy, legal support services, worker and advocate training, coalition building, and public outreach. Next slide, please. Nicole?
Yeah, so what we're going to cover today, again, this is the intro level, looking at health and safety, really the framework of health and safety laws, and also kind of the framework of why people get hurt, looking at the approach that WorkSafe and many health and safety advocates take in terms of focusing from the preventative angle, looking at how we fix the workplace and not blame the worker, the legal framework, and we'll also cover the case study. I'll pass it over to Maggie now.
Hi, thanks, Nicole.
Oh, Maggie, I just wanted to ask people an introductory question before we start. Thanks, everybody. So I did want to ask, who do we have here today? This is our first series, and we wanted to see who we have with us. I put a poll out. It should pop up on your screen. Looks like people are still voting. I'll give it a couple more seconds. All right. So it looks like we have a lot of worker advocates here. Thank you for joining, and also others, which you can feel free to write in the chat box who you are or what you do. Welcome everybody today. I'd also like to see, because we mentioned this is an introduction and we're setting the foundation today for the rest of the workshop series, we'd like to know what you have the most experience in related to topics we will discuss today. Feel free to choose more than one option. And the poll should pop up on your screen. I'll give people a couple more seconds as more votes are coming in. All right. This is great. A lot of you have experience with employment law, organizing and worker advocacy, and great that a lot of people are here to learn. All right, I will pass it off to you, Maggie.
All right. So to get started, I thought we'd set the ground by just having you think through a couple of questions. There's real simple true, false, sort of agree, disagree questions. So think about it for a second. Give us just your gut, true, false, and then in the chat put just the one reason why, true or false, and then just say why. So most injuries happen because workers are careless or ignore safety policies. What's your gut tell you on that one?
All right, I'll give people a few more seconds. Looks like some votes are still coming in. All right, Maggie, so we have about 98% of people say false.
All right. Let's go on to the next question. Actually, what's coming in the chat? Are there any?
Sure, we have work sites can be unsafe, like constructions and kitchens. Okay. Is one comment we've received. Do not see any others yet. Employers are responsible for setting and controlling the environment.
Okay, so let's go on to the next question then. Hold on. So the biggest problem is that workers don't take safety seriously. And then give us a reason why you say yes or no.
couple more seconds as votes are coming in. Okay, so we have 95% false right now. Somebody asking if the chat is working correctly. It is. It's just that some people have selected to share their answers with just the panelists. So make sure when you are chatting, if you want everybody to see, that you select all panelists and attendees. So 95% said that was false. Someone shared that they serve as a union steward for school employees union, and that injuries happen because of pressure to produce. Workers don't feel they have a choice in how to conduct their duties. Many employers don't take safety seriously. Employers' incentive to cut costs leads to lax safety standards.
Okay.
Yeah.
So you all have got a pretty
Training.
nuanced understanding of reality, so this is great to see. We have one more question, which is about the more specific topic that we're going to be focusing on in this series, which is about COVID. And this one is, for most people, the biggest risk of COVID is from their personal choices, not their work. True, false, and then again in the chat, why you're, one big reason why you made that choice.
I'll give a couple more seconds as some votes are coming in before ending the poll. We have a comment that says workers are scared of COVID in the workplace because employers don't have proper protections. People aren't eligible for unemployment if told they can come back to work, or may believe they're not eligible, so have to take the risk in order to have income. We have 87% false for this poll.
Okay. Well, thank you for trying to make a hard choice on some of these. I know a lot of you were heavily skewed towards one answer or another in here, but I expect in your head you also were seeing that for some of these there might be a grain of truth to them, but that the real world of work is a lot more complicated, and the comments you made in the chat show that you recognize that. In my experience of asking questions similar to this to workers in workshops, all over, that they often will get into robust arguments about, well, of course there's a shade of truth to these, but the larger point that you've made in your comments and that I wanted to draw from asking these questions is that there is a much larger complex issue at work, and the employer has a moral as well as a legal obligation to provide a safe work environment, and it's something that they often don't do very well. One way I often put that is that employers design the work. They've decided what is happening, they decide how it's happening, they're the ones who purchase the tools and equipment, they decide the work methods. There's a vast number of decisions that they make that all affect safety. Whether or not the employer, when setting up the work environment, recognizes that all of those are safety choices, the reality is they are safety choices. And so by setting up and designing the work and the work processes and the equipment choices, they're setting the stage for the safety conditions in the work. So I'm glad to see that you're a pretty sophisticated audience and have a lot of understanding of this already. We see signs like this all the time in work sites, and I guess the lesson here is that giving people signs and instructions and telling them to be safe is not a safety program. And one way to really realize this is that if you have work sites in the same industry, some of them are going to be much safer than others, even same industry doing the same work. And some of them are consistently much safer, and some of them are consistently much more dangerous. And that by itself is an indication that safety is something you have to plan for, and that you can plan to do it pretty consistently. And if you don't plan for it, then you're going to end up with more people getting hurt and injured on the job. WorkSafe, when we think about safety, we have a couple of sort of approaches we think about, and this is what they are. And I guess we start really, I'm not going to go through all these, but the primary one is injuries, illnesses, and deaths can be prevented. And by doing proper planning of the work, we can contribute to that, but also workers need to have a say in how the work is done, and they need to have the ability to stop things when things look dangerous or when things aren't going as they should be going. It's critically important. It's the hazardous conditions that injure workers, not just workers' own behavior. It's usually a secondary factor, and it's primarily unsafe conditions that cause workers to have to do the things that end up giving them injuries. The third point I want to make a little bit here, the third bullet is there's often a big gap between the safety procedures an employer says that the worker should follow and what it actually takes to get the job done. That's sort of the job as designed versus job in reality. And in your work with workers, it's critically important to understand that difference, that the employer may say the rule says you do it like this, X, Y, Z, but the reality is that they do A, B, C. That's not the workers doing something wrong. That's the work as it needs to be done. And it's helpful if you're trying to help a worker understand how to improve their conditions, is to help shine a light on that gap between the theory and the practice of work, and how to make the two come together in some way that provides a safe work environment. And just one last thought is that, work is an essential activity in our world, and it can cause a lot of benefits to people, from their income to potentially retirement savings to social interactions to joy and meaning in some cases with people's work. But it also can cause harm, and listed on this slide are some of the ways in which it can cause harm. And really for the rest of this, we're going to focus on that top one, which is occupational injury and disease. The occupational safety and health profession we talk about safety conditions. We tend to label things as hazards, right? I think some people use that term already. And hazard is just a way in which the work can hurt you. And we've, the safety and health professionals have divided it into groupings as a way to just help kind of sort out the different varieties of hazards that are out there in the workplace. So this diagram, it's not some, out of somebody's manual or something. It's more just a way we try to represent these hazards to you as a way to help you think about it. So when you're interviewing clients or, talking to your members about their working conditions, it's helpful to be able to look for all of these different kinds of hazards in the work that they're describing. So just real briefly to talk about them. So we have safety hazards. So that's things that can cause sort of traumatic injury to the body. So things like cuts or amputations or being struck by something or crushed. Falls would fall into that. Often what's called housekeeping is a factor, like how neat or how cluttered is the work environment. The next grouping is physical hazards. So that's other things in the environment that can cause harm to the body beyond safety. So things like electricity, lightning, noise, heat, humidity, cold, vibration, radiation, things such as that. Another grouping of hazards is chemical hazards, and chemicals all forms from solids to gases to liquids and everything in between them. They can be absorbed through the skin, ingested or inhaled, pretty much is the way we get exposed to those. There's a whole category of infectious and biological hazards, and clearly COVID is one of those. It's one of these infectious diseases that humans can get from each other. There are many other infectious diseases, and often that's what people think of when they think of biological hazards, but there's really more there too. So there are the ones when humans are dealing with other humans, such as in healthcare, or dealing with human waste. So people who work in sewage treatment plants, for example, or with solid waste, there's biological hazards there. There's people who work in moldy environments, either indoors or outdoors. There's people who might work around animals or animal carcasses or animal waste, or might be actually bitten by animals. So things like rabies or snake bites or flea bites and various diseases. So there's a variety of biological hazards out there that, depending on the nature of the work people have, could be significant. Or people who work outdoors on poison oak would be another example. Another category of hazards is ergonomic hazards, and ergonomics is the science of looking at the design of work to be within the capacities of the human body. We often think of that in terms of the forceful motions, repetitive motions, or the postures that a person must do their work within, but it actually is broader than that. It includes things such as the cognitive and visual ability that somebody has to do their work. So it's actually quite a robust field. And in the middle here, this thing we're calling work organization, this is something really, I think, occupational health people have been talking about more in the last couple of decades. And that is, does the work cause a lot of distress and stress to the workers? And so that would be things like, what is the workload? How intense is the work? How fearful do people feel in the work? Is there flexibility to allow people the flexibility to, for example, accommodate their personal life? Do they have control over the work that they do? Things such as that. Is it a collegial environment, a supportive environment, or is it a hostile environment? And the reason this one's in the center is because often it interacts with these others. So for example, if you've got a really high stress, fast paced, non-supportive work environment and you're working around chemicals and there's a problem and you're fearful about a spill, for example, or a potential exposure to something toxic, if you don't have control over your work, it's much harder for you to control that and to try and make that safe for you because of this condition, right? So this way of looking at working conditions, I think, might be able to help you when you're looking at the stories from your clients or from your members or workers about the conditions that they're facing, so that you can ask them better questions about what the conditions are. And one last conceptual thing we'd like to talk about is, if you have identified hazards in a workplace and you're an employer, then you have an obligation to control those hazards. That is, your legal obligation is to reduce the risk of injury or illness from those hazards. In the health and safety profession, we have a way of looking at the idea that some types of controls are consistently more effective than other types of controls. So that we call that the hierarchy of controls. So some types of controls are just more effective than others. They're more reliable. At the top of that hierarchy, the thing that is most effective and reliable is to eliminate the hazard entirely or to substitute a safer thing in for the more dangerous one. We most often think of this in terms of chemical hazards. Hold on, I'm catching up with myself in my notes here. So you might think of something such as using lead without paint. So it's still paint, but you substituted from a lead paint to a non-lead paint. Or you might have heard of people having latex allergies and people not using latex gloves anymore. They use a different kind of polymer to make the glove to remove the latex from the glove material. So those would be some examples. Another way to eliminate a hazard in settings, say construction, a more physical hazard, you can construct things up in the air, or sometimes you can do some of the assembly on the ground, and then you can lift that thing into the air and secure it in place. So you can reduce one hazard, that is risk of falling while constructing, by doing some of the construction in a place where they can't fall, so on the ground. If you can't eliminate or substitute a hazard, the model would go that you then try to engineer the work to be safer. And as was pointed out in your comments earlier, the employer really designs the work. They made all these decisions about how the work is done, the chemicals that are used, the materials and equipment that are used, the techniques that are used. All of that is engineered, basically. And so the point of engineering controls is to try and mitigate the hazard that you can't eliminate. There are many examples of this out in the workplace, but a real simple one you can think of is you've got that vent over the stove in your kitchen, hopefully, that helps exhaust out the cooking, fumes and smoke out of your kitchen, to keep you from having to inhale it. It could have equipment that's surrounded by a noise enclosing structure. You could have machine guarding to keep you from being able to put your hands into the moving part of the machine. There's just many, many, many types of engineering controls out there that are in use, or should be in use. So if you can't engineer or eliminate a hazard away, the next most effective thing is to have administrative controls, which is kind of a strange word, but it basically means the human side of the work. Things such as how many employees you have doing the work, what is their skill set, are they trained, do you have clear operating procedures? It's things such as that. So it could be things like having an alarm system to cue people that they should do something when that alarm goes off. Those are all administrative controls. And one of the reasons they're fairly low on the hierarchy is because they can be changed in an instant. Your administrative control might be having a certain number of employees, and then you decide all of a sudden to have fewer employees. So that will be a problem.
Maggie just wanted to say it sounds like there's some like paper rustling, or the mic is picking up. Okay.
Sorry about that. That's my papers on my computer. I will cease from doing that. Thank you for letting me know. So I was on administrative controls, yes. So the thing about administrative controls is that all it takes is one decision for that control to be reversed, whether it's, as I mentioned, staffing levels, or you can decide to cease training people, or you can decide to turn off the alarms or remove the signs from the wall, all of those kinds of things. But these can be helpful. And at the bottom of the hierarchy is personal protective equipment, or PPE. So personal protective equipment is at the bottom of the hierarchy for a variety of reasons. One is that it requires that workers wear it. Actually, let me step back. I think I forgot to define personal protective equipment. PPE is something that the person has to wear on their physical body to protect them from the hazard that they're being exposed to. So easy examples would be gloves to keep a chemical off your hands, for example, or a respirator to keep you from inhaling a toxic material. The reason that it's at the bottom is because it requires workers wear the gear consistently every day, all the time, in order to have protection. It requires that the gear be properly fitted in order for it to be effective, and sometimes that can be a challenge. It can get in the way of doing work at the speed that's needed, or with the accuracy you need. For example, gloves can make it hard to do things with your fingers. Or if you need to speak and you have to wear a respirator, it can inhibit your being able to speak accurately. They can limit communication. They can add risk to the work, and an easy example of that is that if you're wearing a type of glove that's loose, say to prevent cuts, but you work around machinery that could catch it and pull your hand in, then wearing the glove could add a risk of having a traumatic injury to your hand. And the last thing about PPE is that if you run out of it, then you're not protected at all, and we've certainly been hearing a lot about that in the world of COVID. So I encourage you to think for a minute about what would these be in the case of COVID? What would elimination look like, for example? So one example might be that to eliminate, you would have guests who are coming to your work site, visitors of some kind, not actually come in. You would deal with them out on the curb, right, or outside. So then they're not coming into the workplace. It's a way to eliminate them. Engineering controls might be to provide enhanced ventilation so that if somebody is emitting virus inside your work environment, that you ventilate it as way before other people have a chance to breathe that same air. You might redesign your workstations and workflows so that people can always maintain at least 6 feet distance from other workers. or other customers, or depending on who's in your work site. You might change the location of workstations. You might reduce the need for physical interaction at work, such as requiring signatures. You would just no longer require a signature, so people don't have to approach each other and share pens and paper, as examples. Administrative controls might be things such as staggering the shift start times and staggering meal and break times so that there's less opportunity for people to collect up in shared places in the work site. PPE might be things like gloves to, for example, keep your hands clean when you're touching things that other people have touched. And it might remind you not to touch your face, which is something that we're telling people they shouldn't do. So this was just by way of example for you, and we hope that when you're thinking about what one of your clients or members is telling you about their exposures, that you'll think about the types of controls that might need to be in place. I think it's a real tendency to want to go for personal protective equipment because you feel like you can control that as a worker. But often, as this hierarchy indicates, it's not the most effective, and it requires a lot of burden on the worker in order to make it effective to the extent that it is. And this is my last slide, and I'll hand it over to Nicole. The health and safety field is very broad, and this is just a high level to let you know that there's a lot of different specialties out there that you might want to have access to depending on the nature of your work. So a big player in health and safety field is government. In California, that would be the Department of Industrial Relations, where they promulgate regulations and they enforce and oversee the regulatory bodies. Or the regulation of the employers. At the national level, there's similar organizations in federal OSHA, and in other states, there's state OSHA programs. In public health, the Public Health Department in California has the Occupational Health Branch, and they're sort of a research unit, I guess I would call them, and they take care of doing something like epidemiological research, and they'll look sometimes deeply into specific occupational hazards and make recommendations related to them. There's the whole field of occupational medicine and nursing, where they understand exactly what the harm is that happens to the human body from work. There's a number of different engineering professions that have a lot of deep knowledge about the ways to keep work safe and design work safer. Industrial hygiene, it's not a term most of us know, but industrial hygiene is people who understand the health effects of work on people. Engineers are more about the safety effects, but industrial hygiene is more about the health effects, such as chemical exposures, how to measure chemical exposures and things such as that. Ergonomics, I've described earlier, is people who look at the physical design of work to be within the human body's capacities. Toxicologists look at the effects of chemicals on the body. And then there's a whole realm out there of advocates such as us, WorkSafe, the committees on occupational safety and health. A lot of unions do advocacy around safety. There's a lot of worker centers who do advocacy. So there's a whole world of advocates out there that also could be helpful to you. And now I'm going to pass it over to Nicole to go into a little bit more detail about what some of the legal obligations are.
Thanks, Maggie. Next slide. So I'll be covering the OSHA legal framework. Next slide. Really focusing on kind of a brief overview of the workplace safety regulatory framework, really with that eye towards prevention, right? As my colleague Maggie had mentioned, we'll look at the California state laws and the regulations that CalOSHA would be enforcing. Very briefly, looking just a touch at the guidance that CalOSHA has issued around COVID-19 and the interplay with occupational safety and health regulations, enforcement, and other advocacy and policy work. Next slide, please. So we'll start with the brief overview of CalOSHA as an agency. It is where it lives in terms of the labor code. It's under 6300 at SEC. And when we look at CalOSHA, this is really, there are three kind of components to it. CalOSHA, the enforcement part, is the Division of Occupational Safety and Health. They are the ones that would be involved in the inspections and issuing citations. The Occupational Safety and Health Appeals Board is the body that where an employer would go and appeal a citation, and then there would be an adjudication of that. And then you have the Occupational Safety and Health Standards Board, and that's kind of the mini legislative branch that issues the regulation or standards rather that touch on the that are the standards that the division enforces. Next slide, please. So CalOSHA as an agency is really looking at kind of the, oh, next slide, please.
Oh, sorry.
Almost all workers are covered under CalOSHA, public employees and undocumented workers. CalOSHA is also, when they receive a complaint, are required to keep the name of the person in confidence unless the worker agrees to reveal that information. Never does that become available to the employer unless the worker, the complainant agrees to that. The workers that are not covered under CalOSHA are independent contractors, and we see this probably will be coming up with folks who are misclassified and the interplay with AB5. So we'll be covering that. We'll be touching on that in later sessions. Federal employees, workers who are engaged in domestic household services, such as domestic workers and day laborers, and family members of farm owners who work on the family farm. Next slide, please. And these are the regulations that we will dig a little deeper in that are, the ones that we've identified as being related to the issues that workers are seeing in their workplaces, the IIPP, the aerosol transmissible disease standard, sanitation, and just kind of general sanitation, control of harmful exposure, which really speaks to the hierarchy of controls that my colleague Maggie had mentioned, personal protective equipment, the HAZCOM standard, and anti-retaliation whistleblower standards. We'll dig in deeper into these standards in later sessions, but just these are preview for you now. Next slide, please. So we look at kind of OSHA rights in these three buckets. In categories of workers have the rights, and employers have duties and obligations. So that's really also important in terms of the framework, as we started off with the questions around kind of looking at what the responsibilities and the ownership of employers really having the duties, and then workers having the rights to really be involved in what solutions should look like. Really coming from this perspective of workers are the experts of their workplaces. So we have the right to know, the right to protection, and the right to take action. And I'll explain each of those. Next slide, please. So really the right to know is about the employer's responsibility in making sure that workers understand the risks associated with exposure to coronavirus. That would involve training. That would involve training that is effective. So it's not just kind of a list of things given to the worker. It is in a different language that folks might not understand. It really has to be something that is effective for workers to understand. The right to know is really about kind of workers' ability to be able to get information and have access to that information about kind of what the employer's safety and health plan and protocols are, and other information. around reporting, and what are ways that the COVID is transmitted in the workplace, being able to identify and understand, so that way workers are given the proper proper protection, whether that be through control measures in which are required under the laws that I had just shown you. Next slide, please. The right to protection, I really want to kind of hone in on this. This goes beyond personal protective equipment, as mentioned by Maggie. You know, the hierarchy of controls really places the personal protective equipment as the least protective measure, and so within the laws there are there's a real focus and emphasis on the employer's responsibility to look at ways to eliminate the hazard, and then if not feasible, moving down that thread of kind of the hierarchy of controls. And so the engineering controls, kind of like changing the structure of the way work is performed, is really on the onus is on the employer, and the personal protective equipment is kind of this least protective measure. It is important, but really focusing and emphasizing on those other things. The PPE also, if an employer does provide that, finds that it is necessary, then that needs to be provided to workers without charge and not deducting it from their paycheck. And then just providing a safe, a healthy and sanitary workplace is also a legal requirement under this bucket of right to protection. Next slide, please. The right to take action is really about workers using their power as workers, and also working collectively with other folks. You know, where there is a union, there's a lot more power in that. Where there is no union, you know, it's quite difficult to kind of there's a lot of fear and uncertainty with job security, especially with folks. You know, I think some folks raise this about not knowing if they're going to be able to be eligible or receive unemployment. And so we really see that intersection there and understand that, and you know, we know that these are the rights and these are the laws that folks have, and it doesn't always play out in real life. So these are things that workers can take action on, and they're protected, supposed to be protected, complaining about health and safety issues, complaining about exposure risks, complaining about refusing unsafe work, and participating in workplace health and safety committees, and participating in any inspections or proceedings that involve an appeal of a citation. Next slide, please. So the right to refuse unsafe work is a very, you know, it's very much front and center for folks being able to use that right. And this really requires, you know, a very nuanced approach to understanding kind of how to best and successfully use and leverage this right. And so we will dig in deeper into kind of the more nuanced approach, but just wanted to offer this kind of as background, and really is kind of for the purposes of this presentation, I'll just mention these few steps. It is kind of on a case-by-case analysis, and so what we're really encouraging folks to do is not simply you know, step off the job, but to take these steps, tell your supervisor, ask for a union representative or worker center representative, tell supervisor you won't do the job unless it's made safe, offer to do the work that is not dangerous, ask for a safety manager to inspect the work site, and call the Division of Occupational Safety and Health, the enforcement branch, to do an imminent danger inspection. This we'll dig in deeper into this in later series. Next slide, please. And so, as I mentioned, we kind of group these into employee rights and employer obligations and duties. And just generally, employers have the duty to provide a healthy and safe work environment, and other duties that are triggered in those standards that I had shown in earlier slides also require employer to take responsibility, to take active steps in the prevention and identification and in implementing other controls to minimize, reduce, and prevent exposure to COVID-19 and other injurious situations at the workplace. Next slide, please. So as we mentioned, or as I mentioned earlier, there are general industry guidelines for COVID-19. You know, these are guidance from CalOSHA. There are several guidances, more than several. There's quite a few guidances that CalOSHA has issued that are industry specific, but these are the ones that are for kind of general industry and would be applicable at the minimum, right, to protect workers and from exposure, and also kind of triggering employers' responsibilities, right? It's an interpretation of the standards that we had that shared in earlier slides, and this is really looking at kind of what in making sure that employers are actively encouraging sick employees to stay home, sending employees home with acute respiratory symptoms immediately, providing information, accessible information, making sure that it's effective, and training to employees on these various kind of points, and providing tissue, all of these kind of other steps around kind of sanitation and encouraging frequent hand washing, doing all of this without the fear of retaliation. Next slide, please. Again, you know, going beyond kind of your routine environmental cleaning of shared workplaces, and looking at kind of what you know, those making sure that folks understand what those additional cleaning requirements will look like, who is going to be the point person if it's required to kind of shut down certain areas, and not kind of like having an ad hoc, but really being intentional in incorporating these things into your IIPP, allowing flexible work sites for social distancing, and using other methods of minimizing exposure between employees, postponing or canceling large work-related or meetings. Next slide, please. There's more guidance, as I mentioned, with CalOSHA around industry-specific issues, Center for Disease Control, looking at the Department of Public Health and their guidance to employers and county public health departments around workplace outbreak management, FEHA, the ADA, and HIPAA. Kind of, these will dig in deeper in later sessions. Next slide, please. So we have a case study for you all, and we sent it out a couple days ago. We're not going to have breakout groups, but I did want to give folks the opportunity to just kind of in the chat, if they could kind of raise, you know, the 3 most significant issues that they saw in the hypothetical, and we'll cover the ones that we identified in the next slide. But I wanted to first just offer folks the opportunity to quickly in the chat ID any issues. Actually, really kind of thinking about the framework that Maggie shared, and the framework, the legal framework that I just shared. If you can kind of like marry those two and kind of see. We really want to be able to see how how you are able to kind of issue spot by using that material that we just shared. So if folks want to just chime in the chat, issues they saw in the hypothetical, the case study.
So let's give people maybe like a few minutes to put things in the chat.
Great. All right. Why don't we go to the next slide and just I can highlight some of the ones that we identified. Next slide, please.
Sure, I can share what some people put. Some people identify discrimination, retaliation, failure to provide appropriate PPE, lack of hand sanitizer, lack of plexiglass in the grocery store, sanitation. So it looks like people are picking up on hierarchy of controls, which is good. Go ahead, Nicole.
Great, yeah. So yeah, these are the you know, the significant issues, really kind of looking at the hierarchy of controls and the categories of hazards that impact workers that Maggie shared, and also looking at kind of these buckets of rights: right to protection, right to information, right to know, and right to act. And so we're looking at the temperature checks, the other screening measures that the employer has, looking at the COVID positive patients and working with folks there, the ATD standard, effective personal protective equipment, distinctions between the N95 and surgical masks, new disinfectants that will probably give rise to other kind of health, respiratory, reproductive hazards that people people should be queuing into, discriminatory and retaliatory action by employer, hand washing access, looking at COVID prevention and protocols, at the control measures again, training on those protocols and reporting protocols and control measures, workplace violence prevention. Definitely seen an increase in kind of the hostile and workplace violence, you know, really from the spectrum of people being assaulted to people being attacked fatally. And so this is something that we should be queuing into. Cleaning protocols and supplies, inadequate supervisors, and support on safety. And those are the significant issues. I'm going to turn it over to Karine to wrap us up here. Thanks for chiming in all and sharing what you all identified.
Hi, everybody. Thank you for attending today. I wanted to mention again that that the case study will be used in future trainings. So reading it now helps prepare. It is longer, so reading it now and being aware of it will help make breakout activities where we analyze some of these employer obligations and legal duties in detail in future trainings easier. So we also wanted to let you know that when you click exit, it will bring you to a Zoom page for an evaluation. And instead of clicking X right out of it, especially if you want MCLE credit, if you did that, then you will miss the survey that's required to receive the certificate of attendance. We do want, if you're able to provide feedback, it doesn't matter if you need this credit or not, so that way we can improve the next training, anything to do with the slides, the captioning, the pace. This was our introduction to the issues, and as we continue, we'll get more and more into detail. So I believe that's all we have. I do want to share that our next.
Sorry,
Go ahead.
I'm not sure which slide you want to be on.
Oh yeah, it's fine. I think we're done with the slides. I just wanted to share next week we'll be doing legal advocacy for safety and health and starting to dig into these standards into more detail. And so yeah, thank you for attending. Thank you, panelists.
Thank you. Bye, everyone.